Hello,
Yeah.
Dr. Asawari Sant, good evening.
Good
Dr.
evening.
Asawari Sant is a consultant pathologist from Aabha Diagnostic and Dakshata Hospital. Good evening, ma'am. Welcome to All
Good
About
evening.
Belgaum.
Thank you very
Ma'am,
much for having me.
ma'am, I have a few questions I would like to ask you.
And
What are the different tests available to diagnose coronavirus infection, ma'am?
yeah, thank you for inviting me today and having us on your page and channel. At the outset, I wish everybody a very happy Ganesh festival. Please celebrate responsibly. Um, should not forget SMS ever. So you must have social distancing, mask, and sanitizer. That's compulsory. And then Ganpati will also be very happy with you. Coming to the question, the different types of tests, let us not go too much theoretical. Whatever is available in Belgaum, I'll tell you about that. So we have rapid antigen test, which is a test which hardly requires half an hour to do, and that is available now at two places in BIMS as well as, I mean, in civil hospital as well as the DHO office near Vadgaon. They are also doing the rapid antigen test. This test is done by taking a nasopharyngeal swab. इसका मतलब है कि एक स्टिक जैसा कुछ जिसके ऊपर कॉटन लगा होगा वो आपकी नाक में से अंदर जाएगा और वहां का सिक्रीशन लेके उसका टेस्ट होगा. तो ये टेस्ट आप जानते हैं जैसे प्रेगनेंसी टेस्ट रहता है उस तरीके का कार्ड टेस्ट है और उसमें अगर 2 लाइंस आएंगे तो it is positive. Okay, so it's a quick test, like the name suggests, it's a rapid test. The other type of test which we have, so if you come positive by rapid antigen test, you definitely have coronavirus infection. If you come negative by the rapid antigen test, but you have some symptoms like fever, cough, loss of smell, loss of taste. Some people may complain of diarrhea. Body ache is very severe in coronavirus infection. So, any of these symptoms, if you have, then you must confirm it by the RT-PCR test. Again, RT-PCR is also available at two places in Belgaum. So you have the civil hospital where you can give your sample, and you have KLE Hospital Flu Clinic where you can give the sample. Now the testing for these is done at the ICMR sub-center also and in JN Medical College as well, Department of Microbiology. So these are the diagnostic tests which we have. Now there is another machine called a CBNAT or TrueNAT machine. We know of this machine as Gene Expert. We used to use it for the diagnosis of tuberculosis. That has been repurposed and the cartridges have been changed to give you COVID testing. So that is also available in BIMS hospital and civil hospital. It was available for some time in KLE, but right now I think that particular machine, they are not using it. They are doing only rapid and RT-PCR test. So these are your three tests which you have for diagnosis of coronavirus. And I would like to make a very important point. If you have any of the symptoms, please don't be scared of getting tested. You must get tested. There is no need to panic about it. A positive result of corona does not mean the end of the road. There is a treatment available. The earlier you take the treatment, the better. So please don't panic. Please go ahead and get yourself tested. So these are the tests, Kiran. And then there is another test which is antibody test, but that is not really a diagnostic test. It is more of a test to come to know, had you been exposed maybe 15, 20 days ago, were you exposed to the virus? That's all you'll come to know by the antibody test. So that is only for sero surveillance. So for diagnosis, it is these three tests: rapid antigen, RT-PCR, and TrueNAT test or CBNAT test, which are available. Now, these are all going to test the presence of some part of that virus in your body. Okay. And because the point of entry is from the face, that means either eyes, nose, nostrils, or mouth, we are taking this swab from the nasopharyngeal area where the maximum amount of virus is usually present. So that is how you will come to know whether you are infected or not infected.
Okay, ma'am. Thank you. Ma'am, my next question would be, is there a chance that person with positive test is not infected with coronavirus, or person with negative test results as has infection? What are false
Yes.
negative tests, ma'am?
Yeah, yeah. So there is a concept called specificity and sensitivity in all kind of testing. Okay, so I'll not go too much into the technical parts of it, but and please remember that if you are positive by any of these three tests, either RT-PCR, rapid antigen test, or a true NAT or CB-NAT test, you definitely have an infection of coronavirus. There is very little chance, very little chance of giving a false positive report. But false negatives are very common because the sensitivity of the tests which we are using is around 70%. So what does this mean? If you test 100 people who are infected, only 70% people will show you positive result. So 30 people who are infected will still get a negative test. That is the problem with the kit, with the equipment. I can't say problem. It is an inherent thing about the technology and the techniques which we are using. So 30 people out of 100 who have the infection may not get a positive result. So what are we supposed to do then? So we have to take radiology. That means a CT scan, a blood test, or a routine parameter test, then the RT-PCR test, and most important, the clinical findings. So when you put all these four together, you will not miss a single patient. That is for sure. But you can't rely on only one thing. Sometimes it may give a negative result, but you are still infected by coronavirus. Okay, so that is a thing to remember. And another thing I want to clarify, nobody will give you a positive result just for the heck of it. If it is a positive result, you do have that infection. Okay,
Okay.
so please remember this. Don't spread this kind of misinformation that anybody who goes, they are giving it positive. They are not in a, they are not crazy people doing the tests there. They will give it positive only when it is positive. So there is a lot of misunderstanding among people that has to be removed. A positive test means you are infected. You may not have symptoms, but you can be infected. Okay. And
Okay, there
other
are
way
chances
around,
of getting infected.
yeah, yeah. It may be the first day of your infection. Little later, it may start. You may start showing the symptoms also. And moreover, don't go for the test in the first 5 days. So suppose today you got some sore throat, a little bit of fever. Consult your doctor on the teleconsultation. Again, I would urge you, don't wait till end of 5 days, but don't flood the clinics. When you go to the clinic, you are spreading that infection. It is good that you can take advice on the phone also. Now, Medical Council of India has allowed us to do teleconsultation, which was not allowed before. So because of this very peculiar disease, which is, putting the doctors also at risk, it is putting everybody at risk. So let us prevent crowding, and let us you can take a consultation on the phone. But if the symptoms persist for 5 days to 7 days, then that is the ideal time to do the test. So between 5 and 7 days will be the ideal time to go for a swab test. That is
Swab
when
test.
you will get highest percentage of positive results.
Madam, what is the utility of antibody test?
Yeah. So antibody test as of now, uh, we are using mainly for surveillance. So whenever there is a pandemic situation like this, the government, the health agencies, everybody would want to know what is the percentage of population who maybe had asymptomatic infection. मतलब उनको पता भी नहीं चला कि उनको इन्फेक्शन था, मगर होके गया है ऑलरेडी. अब वो एंटीबॉडीज उनमें पॉजिटिव है. तो एंटीबॉडी क्या है? पहले मैंने जो बोला कि डायग्नोस्टिक टेस्ट में वी आर टेस्टिंग अ पार्ट ऑफ दैट वायरस. इज इट प्रेजेंट इन योर बॉडी? इन द एंटीबॉडी टेस्ट वी आर टेस्टिंग योर बॉडीज रिएक्शन to that virus. So you prepare antibodies against the virus. So if you were infected 14 to 21 days ago, then only antibody test will come positive. It will not come positive within first week, because the body takes time for developing. So 7 to 14 days में एक प्रकार का antibody आएगा जिसका नाम है IgM, and 14 days onwards IgG भी आ जाएगा. So these are antibodies which your body has prepared to fight that infection, and the main purpose of this is to only know whether you were exposed. अभी ये एक्सपोजर क्यों चाहिए हमको? So there is a concept which is called as herd immunity. So concept of herd immunity means that if majority of the population in that particular area, say a containment zone or in a company, suppose you do a survey, many people have got antibodies, that is a good sign. It means that the virus will not survive for very long, because you know what is a virus? It requires another human being to survive. So from one person to go to another, that is its main job. That's how it survives. So if it doesn't find a host, so the host already has antibodies, the virus will be destroyed, isn't it? So then it will not have another host to go in. Then the level of the spread of the disease will slowly come down. Okay.
Okay,
Some
ma'am.
governments, government is advising certain companies or certain areas which had a high incidence to do it and give them the data. How many percent people already have the antibody? In some diseases, antibody positive means that you will never get that disease again. But that has not been proved about COVID as of now. So we don't know. We are in a very early stage. We have to find out कि एंटीबॉडी पॉजिटिव आया मतलब इनको फिर से कभी कोविड होगा या नहीं होगा, ये अभी तक हमको मालूम नहीं है. उसके लिए भी एंटीबॉडी टेस्टिंग बहुत महत्वपूर्ण है हमारे डेटा कलेक्शन में.
Madam, what other blood tests could be useful for COVID?
Right. So this is a very important question, and again, 2-3 things I want to say about this. So आपको 5 या 7 दिन तक कोई symptoms थे, तो आपने either टेलीकंसल्टेशन किया या आप किसी फ्लू क्लिनिक में गए. उनको ऐसे लगा कि आपको हो सकता है कोविड, तो आपने स्वॉब भी दिया है. उसके साथ जैसे मैंने कहा कि 30% पीपल में कम बैक विथ अ नेगेटिव रिजल्ट इवन दो दे हैव ए infection. So we are now doing a 4 point strategy sort of. One is clinical. Second is you will do the HRCT, which is a high resolution CT scan of the chest. And you will also side by side give the swab for testing, and you may be advised certain blood tests. तो कंप्लीट ब्लड काउंट में अगर न्यूट्रोफिल बहुत ज्यादा है और लिम्फोसाइट नाम का जो हमारे शरीर में WBC है वो बहुत कम है, तो वो एक इंडिकेटर हम मान रहे हैं कोविड इन्फेक्शन का. लिवर फंक्शन, किडनी फंक्शन टेस्ट हम करके ले रहे हैं, क्योंकि हमें मालूम रहना चाहिए कि इनको जो हम मेडिसिन देंगे तो इनका ऑलरेडी बेसलाइन लिवर फंक्शन, किडनी फंक्शन कैसा है. सो यू डोंट वांट टू स्ट्रेस आउट दिस पर्सन मोर, हिज बॉडी. So you would like to have a baseline investigation of complete blood count, liver and kidney function tests. And then you have certain 5 or 6 tests which are called as inflammatory markers. तो ये जो कोरोना वायरस है, it goes into your lung and it causes a very severe inflammatory reaction. और
Okay,
ये
ma'am.
जज करने के लिए हमें 4 या 5 पैरामीटर्स हैं जिनका नाम है LDH, फेरिटिन, D dimer, procalcitonin. You can do, and you can also the combination of these tests will tell you whether this person has got a inflammation going on in their body. Nowadays they are also adding one more test called interleukin 6. तो ये पूरा कोविड पैनल बोलते हैं इसको, कंप्लीट ब्लड काउंट, LFT RFT मतलब liver function test and renal function test, and then the inflammatory markers according to your condition. Your doctor will tell you that whether you need to get them done or not. A very important test is also CRP. So CRP नाम का एक टेस्ट है. ये सब हमको क्या बताते हैं कि आपके शरीर में कोरोना वायरस के अगेंस्ट कुछ चल रहा है क्या, और ऐसा चल रहा होगा तो अगर टेस्ट भी नेगेटिव आया, आरटीपीसीआर टेस्ट नेगेटिव आया, तो भी हम उनको कोविड सस्पेक्ट वार्ड में ही रखेंगे। हम उनको जनरल वार्ड में रख के बाकी के पेशेंट्स को हम डेंजर में नहीं डालेंगे। सो वी विल हैव टू सेपरेट पॉजिटिव पेशेंट्स, suspected patients and negative patients. That is the main reason we do all these 4-5 parameters of test. So this is what we do when a patient is suspected of having COVID.
Thank you so much, ma'am. Very nicely explained. Thank you so much.
My pleasure.
We have the other panelist with us, Dr. Suraj Joshi.
Hello.
Good evening, doctor.
Hi. Good
Happy
evening,
Ganesh
Kiran.
Chaturthi to you.
Thank you and to all the viewers on all about Belagavi and health plans.
Dr. Suraj Joshi, consultant ENT surgeon at Suraj Joshi's ENT clinic and Rainbow Hospital since 2006. Doctor, I have a few questions to ask you.
Yeah.
What we can expect when we are infected with COVID? How doctors categorize asymptomatic, mild, moderate, and severe cases?
Right. Yeah, Mr. Kiran. So as with Dr. Asawari just spoke about first about the investigations, and after we have investigated, we roughly as doctors put them into two categories. Primarily, let's look at two categories. One is COVID and one is non-COVID. So since we are talking about COVID, let's discuss about the COVID part. In the COVID category, we have, as per the WHO guidelines, we have now four subdivisions. One is mild, which is about 40% of the population who were infected. Moderate, another 40% of population. Severe category, about 15%. And then we have the critical category, the fourth category. Now, so we basically have these divisions as mild, moderate, severe, critical. Critical also we are calling them as acute respiratory distress syndrome, or they go into something called as sepsis. So these are the four categories broadly which we have to define this COVID infection. In the mild category, we have sometimes very basic symptoms, or they might be asymptomatic as well. Now, symptoms could range from simple fever, low-grade fever, or they could have a little stuffy nose, a little sore throat. Sometimes people have conjunctivitis, sometimes a little motion, bowel upset, they might have loose motions, sleep disturbances, loss of taste, loss of smell, anxiety. We also have seen people with depression. So these are the few kind of symptoms which we categorize as mild category. By and large, patients with these mild category of symptoms somewhere present on day 2, 3, or 4, or even 5 after the exposure. And these symptoms, typically like any other virus, they last for about 5 days. Though we have extended the symptoms and the days to about 10 days. So anywhere between 5 to 10 days with these symptoms, a mild category. Next, we have the moderate category of patients, wherein they do have symptoms of cough, a little breathlessness, and when their oxygen saturations are somewhere not normal. Normal is somewhere about 95, 97 and above. But in these moderate patients, they come between 90 and above. So 90 to 95, they have cough, they have unrelenting cough, breathlessness, discomfort. These are symptoms which are typically as moderate. About 40% of patients we see with this category. Next, we have the severe category. The severe category are about 10 to 15% of patients. And definitely here, the cough, the severity of the symptoms in what we see in mild category is much more. Typically, these are the patients who have comorbidities like diabetes, blood pressure, they have kidney problems, malignancies, cancer surgeries, they are some on immunosuppressive therapy, etc. So these are the severe category patients wherein they definitely have oxygen saturation between 75 or even less than that. Sometimes we label them as happy hypoxia, and from that to up to about 90. So less than 90 with severe breathlessness is the severe category of patients. Definitely, they are the ones who need admission. Lastly, a small percentage of patients are the critical ones. about 5% who end up with acute respiratory distress syndrome or sepsis. So they are about 5%, and they have bad prognosis. So these are the four categories of patients that we have devised for the COVID disease. And based on this, the future planning, management, and all is categorized.
Doctor, we are seeing last moment breathlessness and sudden cardiac arrest. What does that mean?
Okay, severe breathlessness, cardiac arrest comes into this critical category of patients. See, definitely they have underlying comorbidities or some kind of, they are on some medications of for immunosuppression, diabetes or uncontrolled diabetes, etc., or kidney failure patients. These are the patients who end up with critical condition. Now, as Dr. Asawari has said, the first 5 days, 6 days, 8 days, 10 days, where they have these early symptoms, it always goes from mild, moderate. Very rarely, it's suddenly like, today morning I'm fine and in the evening I end up with a cardiac arrest. It's very, 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 very small population, very, very small number. Typically, you should have some symptoms which have progressed over the last 4 or 5 days of your exposure, and then you end up definitely with this. So it is probably people are a little scared that it's okay. I'll just carry on. It's a regular flu. This happened to me every year. My general practitioner, my family doctor, my neighbor, my uncle, whoever in the family has given me this antibiotic. He had given me this antibiotic about last time when I had it. So this time, without consulting, I have taken it. So these are the typical histories we see, and then they end up with cardiac arrest and severe respiratory distress, sepsis, etc. So we strongly discourage people to, at this stage, self-medicate themselves. Please go to the doctor and take his or her advice as directed. So these are the conditions where we see the sudden cardiac arrest in patients. And then there is a little complaint about, we had to wait because they have waited for the first 8-10 days, ignoring the symptoms. And the 9th and 10th day, they end up with the complications. So it's very unfortunate, but I think people should be a little more alert in the mild and moderate stages of the disease.
So in categorizing the COVID, like what it is actually.
Yes.
My next question to you would be, what are the treatments options for COVID, especially when hospitalization is required?
Okay. I would also highlight on the mild and moderate part a few do's and don'ts which I come across before I answer this question to you, because the severe category of patients are the ones who definitely require hospitalization, but even moderate and mild cases do require hospitalization. I will discuss a little about, as Dr. Asawari said, sometimes even moderate category or mild category patient, but who are in the high risk group, like patients with uncontrolled diabetes or cancer treatment patients, patients with immunocompromised patients. These are definitely high risk categories. So apart from categorization as mild, moderate, severe, even the risk factors do determine a reason why we should decide that this patient requires admission or no. Admission in the ward or admission in the high dependency unit of the intensive care unit. So we have to go in this order. Now let me just talk about a little with the mild symptoms. Now, many times mild symptoms, when you have a little upper respiratory congestion like sore throat, a little bit of stuffy runny nose, headache, watering of the eyes, fever, loose motions. I have come across a lot of patients in the last about 2 months who keep calling me and they say, I have these symptoms, and my family doctor or my old prescription says, take this. Now, there's a standard rule I would say is avoid antibiotics if there is no evidence of a bacterial infection. This advice is definitely from even the WHO website. Please avoid antibiotics. Antibiotics can sometimes complicate the whole issue, and because antibiotics are not going to help get rid of the viral flu, and antibiotics can induce a diarrhea which can also mask the symptoms of COVID. So we are dealing with more complications. So I would say keep the treatment very simple for mild and moderate cases. Mild and moderate cases who are not in the high risk category can definitely be treated by home isolation, which I strongly recommend. Home isolation with very basic symptomatic treatment like adequate hydration, keep the room well ventilated, avoid contact with anyone in the house. If anybody has to come to give you food or drink or whatever, see to it that they have worn a good mask. And so these are the basic things. Good hydration, good nutrition are the two key factors in managing mild symptoms, and you have to manage for about 5 to 10 days, and they do very well. They recover. As I said, as the statistics goes, about 95% recovery rate is fantastic. So this is all what we need. Treat the symptoms, keep it simple, and be positive, and you will do well with the mild and moderate category of patients. Now, coming to your question of what is the hospital line of management in these critical cases. Now, hospital who require admission. Hospital admission is also for, as I said, the high risk category patients, patients who are 60 and above with comorbidities. Now, they don't, if they are apparently mild symptoms or asymptomatic, they can be managed very well in a room or a basic ward. It just has an oxygen supply and monitoring with the pulse oximeter. So if they are maintaining the saturation of 90 and above with room air, I think they're doing fine. We just give them supportive care, and they do well. So even if they're admitted with the high risk category and they're mild moderate symptoms, we don't have to worry about them. The issue comes with when they are on the high dependency. So when their oxygen saturation start dipping, so if they are into the moderate category with some pneumonia or critical category, then they are admitted in the high dependency unit or the intensive care unit. There is a slight difference between high dependency and intensive care unit. Let's not get into those technical details. But basically, they need a little more intensive care in terms of the medication. All antiviral drugs need to be given. There is a role of steroids. There is a role of now antibiotics come into the picture because we don't want to have secondary lung infections. Secondary lung infections to be avoided, so the role of antibiotics, sepsis should be avoided. So antiviral, steroids, and antibiotics are given to these patients. Apart from the drug management, there is a nutrition management which is very important because of the disturbances in the body structure, in the blood structure. So what happens is sometimes essential elements like electrolytes are dearranged. So sodium, potassium, calcium in the body are dearranged. If they are diabetic and with kidney problems, then more so a reason why we have to be concerned about their electrolyte and fluid management. So these are the patients who require this high dependency intensive care treatment. Oxygen is given through the mask, which is called as HFNO or non-invasive ventilation. And you have an invasive ventilation wherein a tube is passed for ventilation. But that is the last step that is taken. So a lot of patients are doing very well with the non-invasive ventilation, like the high flow nasal oxygen, HFNO, and NIV, so non-invasive ventilation. So these are very good methods where patients are doing very well. The recovery rate is good, and the patients recover in about, depending on their comorbidities, it takes about anywhere 5-10 days for them to recover, and they do well. And then that's how. Last, but the critical patients are the ones who are slightly difficult to treat because they have already ended. That's your first question. Who are these patients who end up with heart problems and who suddenly end up with cardiac arrest? So when they have sepsis, that the infection is spread all over the body, like from the brain to the kidneys, all the vital organs are fired. These are the critical patients where the prognosis is a little bad. So this is how the overview of the management goes from us as doctors.
Thank you. What would you suggest like home care and remedy for this, doctor?
Home care remedy. Okay.
Home care.
Okay. Home care remedy is the most important basic care that we all need to take. And remember, so that because if, say, for example, I'm in the family positive and I'm at home in home isolation, so my family has to be trained to do all the necessary jobs. So I feel this is a very important point which everybody should understand in home isolation. Now, home isolation means typically for the mild and moderate patients who are not in the high risk category. And home isolation, firstly, we should always see that we as doctors, when we advise home isolation, we see to it that there is a facility for home isolation. For families who live in probably just one room or just over a room, home isolation is not possible. So they might need some kind of institutional isolation. But talking about facilities where we do have home isolation, the room should be well ventilated, and you don't have to wear a mask when you're alone in the room. but anybody, your home attendants who are coming to give you food, water, clothes, etc. They basically have to wear a mask whenever they are interacting with you for a very short period. Apart from this, when it comes to the medication part, I would insist on only about three things. One is let's say the vitamin C, zinc, and all these are more like supplements which one can consume. There is no harm in taking them, but definitely I would say there is no role of any antibiotics to be given here. I would dissuade the use of antibiotics in mild to moderate cases of COVID disease. And sometimes even a lot of patients have been asking me, there is news about steroids being given for these patients, because everything is there on the net now. So patients ask, should I take a steroid also? I said, please, steroid is going to flare up the problem. So no steroids at all, no steroids, no antibiotics. It's a viral flu, as Dr. Asawari madam said. It's just about hear me?
Yes, doctor, I can hear you. Hello.
Okay, just a minute. Okay. Can you hear me?
Yes, doctor, we can hear you.
Okay, yeah. So as Dr. Asawari madam said, the body develops antibodies to the virus, and then by about 14, you have enough antibodies that the virus has to find a new host. So, so it's about 14 days that that whole period that we all have to be careful. And it's if you look at it, it becomes a self-limiting condition because your body knows how to fight the virus. So yeah, so no antibiotics, no steroids, lot of hydration, eat fruits, eat healthy fruits. Avoid something which is difficult for digestion, something like some bakery product or something. I would definitely say avoid during this time because we don't want any stomach upset to cause problems. There's a definite no to alcohol, definite no to smoking. Both these are high risk factors for the COVID to get into other systems like kidney, liver, and etc. So we definitely it's a no, and yeah, that's it.
Thank you, doctor. Thank you so much.
Yeah.
We now have Dr. Rachana Shanbhag, Homeopathic Consultant at Homeocare at Tilakwadi, Diploma in Food and Nutrition. Good evening, ma'am. Welcome to All About Belgaum. Yeah. Am I audible, ma'am? Hello?
Yes.
Yeah. Madam, my question to you would be, what is the role of homeopathy in epidemic or pandemic, ma'am?
Yes. This epidemics have caused lot of stress from time to time because they affect many people at a same time with fast pace. So scientific evidence in most of the epidemics have clearly shown that homeopathic medicines can be used as a prophylactic as well as curative. This can be done in two ways. One is through genus epidemicus, and another is for treatment, that is based on individualization method. So this genus epidemicus means the medicines can be used as a prophylactic, and several cases are observed, they are studied, and to form a totality of symptoms. The symptoms are studied, and depending upon the totality, a genus epidemicus is selected for that particular epidemic. And here in COVID, the genus epidemicus is arsenic because it covers the COVID state. That means the symptoms of produced by COVID-19 patient are similar to that of arsenic. This is prophylactic. And when we come to curative part, the medicines can be given based on the unique principle of individualization, because as we consider everybody is different, everybody is unique, the symptoms of the patient, like physical as well as mental, everything is taken into consideration. Then the symptoms are graded, evaluated, and then the totality is formed. This totality is unique for every person, and depending on this, the homeopathic prescriptions are made. This is the main core of homeopathic treatment, you can say. And homeopathy is a system of medicine which is based on a principle of similia similibus curantur, which means like cures like. We homeopaths usually consider the man in the disease more important than the disease in the man, because the disease may change from time to time, but the man remains constant. And our prescriptions mainly depend upon this constant. So in any disease, only peculiar symptoms which are produced by patient are taken into consideration, and then the totality is formed, and based on symptom similarity, a remedy is selected and given in desired dose and potency.
My next question would be, what is homeopathic perspective in COVID, ma'am?
In COVID also, as this is a pandemic, this is a new pandemic, the same thing applies here also. There is no specific remedy for COVID in homeopathy, but based on homeopathic principles, remedies can be given. As I said, this is a new pandemic. Everybody is in a learning process, and everybody is trying and struggling hard to defeat it. And this has a high transmission rate, so this has got a lot of stress. So when we select a remedy for treatment, the prominent symptoms of the patient are taken into consideration, and along with that, his associated symptoms, his mental symptoms, his lab investigation, everything is taken into consideration, because each person's response is different for this disease. This disease has a wide range of symptoms, right from being asymptomatic to very severe. So susceptibility of a person plays very important role here, and which is unique for every person. So this COVID mild and moderate cases are definitely efficiently tackled with homeopathy if the medicine is given on homeopathic principles. And in little severe cases where the patient has severe cough or breathlessness, definitely hospitalization is important, and artificial oxygen support is required. Even if the patient is on homeopathic treatment, the etiquettes like isolation, mask, sanitization, and social distancing are a must. You cannot ignore, or you have to follow them.
Thank you so much, madam. Hello. Yeah, thank you so much.
Yeah, thank you.
Hello, good evening, Dr. Divya Paranjape. She's an Ayurvedic consultant at Sanjeevan Chikitsa Mandir, Maruti, Galli, Belagavi. Faculty in Cahiers, Sri B.M. Kankanwadi Ayurvedic Mahavidyalaya, Shapur, Belagavi. Good evening and a warm welcome to all about Belgavi, madam.
Good evening. Thank you, Kiranji.
Ma'am, my questions to you would be, what are the preventive measures in Ayurveda for COVID?
Yeah, long back, Ayurveda texts, what we call as Samhitas, they have highlighted about infectious diseases or communicable diseases under the heading of Janapadodvamsa. And the main aim of Ayurveda is prevention, what we call as Swasthasya Swasthya Rakshanam. That means to prevent the disease and to preserve your health. So all these rules and regulations for prevention of disease, most importantly infectious diseases, can be broadly classified under two headings. One is Dinacharya, what we call as daily regimen, and Rutucharya, what we call as seasonal regimen. Now, we are actually following some common measures like social distancing, mask etiquette, washing hands, and using sanitizers, and many other things. But still, we are not secure. We are not sure that we are not going to catch the infection. So, presently, our main aim is to improve the immunity. As per Ayurveda, the immunity is of two types. First is Vyadhi Utpadaka Pratibandhakatva, that is to prevent any infectious disease. And second is Vyadhi Bala Virodhikatva, that is the capacity of your body to fight a disease when you catch any infection. Now, for the ease of understanding, I have classified all these rules and regulations under two headings. First one is general measures, and second is the measures to improve or boost your immunity. Under general measures, we have the first and the foremost important thing is when to get up in the morning. Okay, right from getting up in the morning up to going to bed in the night, there are many measures to be followed. So Ayurveda says you have to get up in Brahmi Muhurta, which is between 3 a.m. to 5 a.m. But if not in Brahmi Muhurta, at least you should make it a point to get up before sunrise. Next to that, we have Gandusha and Kavala Dharana. That is, Gandusha means keeping either sesame seed oil or coconut oil in your mouth for a specific duration, and Kavala is to move the same within the mouth. After this, the oil has to be spit out, and then it should be followed by rinsing your mouth with hot water. After this, gargling has to be done. For this, you can use hot water with turmeric and a pinch of salt, or you can also use hot water with Jeshtamad powder, that is glycyrrhiza root powder, or we can use 3% solution of borax, which we call as Tankana, or we can also use honey water, that is 5% solution of honey in normal water. So this is for the health of your throat. Then this should be followed by Vyayama. So this is the most important thing. At least 30 minutes daily you have to spend for your exercise. So under exercise, you can do brisk walk, or you can do yogasana under a trained person. And you can do pranayama, the regular pranayama, which is Anulom Viloma or Bhramari. And you can also do Omkara, chanting of Omkara, which is very useful for improving the health and immunity of your respiratory system. Then coming to the most important point, that is food habits. So what type of food you have to take? So Ayurveda says stresses on Laghu Supachya Ahara, that is light food which is easy for digestion. So this type of food has to be taken not up to the brim. You should stop eating when you are still hungry. Then if you are taking heavy food, then it should be taken up to your half of your capacity. That is Guru Ahara, that is heavy food should be taken only half of your stomach capacity. Always you have to avoid fried stuff, heavy food, and chilled and refrigerated food. So freshly prepared warm food has to be taken. Then another important point is Divaswapna, that is sleeping in daytime has to be avoided, because if you sleep in daytime, it will hamper the digestion and this will lead to many health problems. Then regarding dinner time, so always dinner has to be taken early, and you should keep a gap of at least 2 hours after taking dinner before going to bed. Then apart from this, we have another most important point, that is fumigation, what we call as dhupana. So you have to fumigate your house and the surroundings of your house with neem leaves, camphor, ghee, or mustard seeds, or lobana, which is generally used for dhupana. So it has been proved that this dhupana has the capacity to decrease the microbial load in the environment. So these are under general measures. Coming to specific measures which help to boost the immunity. So we have some single drugs and some formulations. Under single drugs, we have one first thing is Guduchi, what we call as Amrutballi in Kannada, and Gulvel in Marathi. So Guduchi extract is available. 500 mg to 1 gram of extract can be taken internally along with warm water. Amla fresh fruits are very helpful in improving your immunity. You can also take amla candy, which is available. Then ashwagandha root powder can be taken in the dosage of 3 to 5 grams along with warm water or warm milk. Then tulsi water. So you have to process water with tulsi. You can just boil 1 liter of water and switch off the gas and add 20 to 30 leaves of tulsi and keep the mouth of the vessel closed for some time. So this water can be sipped in small amounts throughout the day. So this will also help improving the immunity of your respiratory system. Now this is about single drugs. So regarding gargling, I have told in the beginning itself. Coming to formulations.
Sorry, ma'am. Gargling,
Yeah.
how long do you suggest? What's the duration of gargling?
Usually 150 ml of water, that is 1 full cup size water has to be taken, hot water, and you have to add either borax or turmeric powder and salt. So I have told already what all drugs can be added. So this whole mixture has to be used for gargling. So gargling has to be done until this whole mixture is finished.
Okay. And when you said about group, does Agnihotri help to an extent?
Agnihotri, I think it is just like maybe similar to fumigation. I told you about fumigation. So there are scientific evidences telling that fumigation helps to clear the environment. Microbial load in the environment comes down by fumigation. So maybe that is the scientific reason behind Agnihotri, and it is also some kind of psychological support, like you have a backup that I am doing this and I will be healthy. So this is going to protect me. So that component, psychological component, is also there to help.
Thank you, ma'am. Can we move to the next question?
Apart from this, we also have some formulations. Like Chavanprash is there, Drakshavaleha is there. For small children, Bal Chaturbhadra, a combination is there. So all these are according to the Ayush guidelines. But I stress that Ayurveda actually gives individualistic treatment. So I suggest that Ayurveda physician, and the most suitable single drug or formulation will be advised to you as per your constitution. So that dosage and that particular formulation has to be used by the patient.
Yes, ma'am. Is there any curative treatment for COVID and Ayurveda?
Yeah, as per Ayush guidelines, we have 4 categories of patients. So the first category is asymptomatic patients who are under quarantine, and the second is mild category, wherein actually Dr. Suraj Joshi have already highlighted the symptoms in each category. So first is asymptomatic, then we have mild, moderate, and the fourth severe category with respiratory distress and other symptoms. So as per Ayurveda, that is as per Ayush guidelines, the first category, asymptomatic patients, can be maintained with simple measures which I have already highlighted. That is the general measures under Dinacharya, and also the specific immunity boosting drugs, single drugs or formulations. And then in mild and moderate cases, definitely the Ayurveda treatment can be used as a supportive care, but the treatment is purely symptomatic. Like if there is fever, we have Tribhuvan Kirti Rasa, we have Mahasudarshan Ghanavati. Then if there is cough, we have Sitopaladi Churna, Talisadi Churna, Yashti Madhu Churna. For malaise, that is the body ache, we have Ashwagandha Arishta, Balarishta. So according to the symptom, we have many formulations. So these drugs have to be taken under supervision of a qualified Ayurveda physician.
Yes, ma'am. Thank you. Are there any side effects from Ayurvedic preventive measures? Hello?
Yeah. The Ayush Kadha or different types of kadha have been are being highlighted in the social media nowadays, and people are using it injudiciously. Like for example, I'll tell you, one Ayush kadha is there. So the ingredients of that are tulsi leaves, dalchini, then peppercorns, and shunthi, that is ginger, and raisins and jaggery. So this has to be boiled in 1 cup of water, reduced to half, and taken only twice a day. But what people are doing, they're taking it frequently, like tea or coffee, throughout the day, 4, 5, or 6 times. So this,
Yes.
if it is taken in this way, it might lead to complications like hyperacidity or many other things. Okay, so you have to be very careful while taking these kadhas, because drugs like peppercorns, so pepper is very hot in its potency, what we call as ushna. So it can lead to dryness in your body, it can lead to hyperacidity and other symptoms. So you have to take these things under guidance of a qualified Ayurveda physician.
Because I know a similar case where the person was having kada randomly and he suddenly got hyperacidity and he got a stroke. Probably he was advised continuously not to take so much, but he was still insisting on so much. So, which is the best place, like which is the best site, or which is the best thing you say, like to follow a proper kada recipe? Ayush?
Yeah. Ayush Kada can be taken. The other thing which I usually recommend to my patients is a mixture which is somewhat milder. So it contains coriander seeds, that is dhania, I think around 100 grams, then jeera, 50 grams, then 10 grams each of lavang, then cardamom, that is elaki,
Ilaichi.
then ilaichi, then dalchini, then pepper in very less quantity, almost 5 grams, and little quantity of turmeric. Okay, and you can also add jesht madhu, that is glycyrrhiza root. So this powder can be made at home in normal mixer grinder, and you can store it in a tight container, and you can prepare it like a normal tea. 1 cup of water, to that you can add half or 1 teaspoon of this powder, half to 1 teaspoon, and you can boil it, reduce it to half, and then you can add sugar to your taste. A little bit of milk also can be added. So this can be taken as a regular beverage, but keep in mind that the dosage should be 2 times a day only, not more than that.
Have you put these recipes on Health Pulse, madam?
No, actually, the last time there was one video prepared by my husband, Dr.
Okay.
Gaurang Paranjape, and he has highlighted this mixture. So both Ayush Kada and this mixture, they have been highlighted in his talk.
So anybody is looking for a proper kada ingredients can visit Health Pulse and they can see how it can be done over there. Or I'd request you to once again post something on this, madam. That would be very useful. And the duration to take these kadas, because people are randomly been taking it, and if the body is used to it, it's okay. If it's not used to it, then it lead to some other things also. Thank you so much, madam.
Sure.
Thank you so much.
Thank you.
Thank you so much, doctors. We'll just be taking questions of people now. 1 minute, just unmute all.
Sure.
Our viewers have some questions here. Can a person who is tested positive can be home quarantined? So Suraj has already answered this. Still, doctor, would you like to answer it? Yeah.
I'll just make some small difference
Okay.
between quarantine and
Fine.
isolation. If you are positive,
Okay.
it is isolation. And if you have come in contact with a positive
Primary or
or known
secondary?
positive patient,
Okay.
either ways, and then 14 days that you are going to be away from your activities is called quarantine.
Okay. Thank you so much, doctor. I hope, Jasmine, your question is answered. How much time does the virus stay in the body? Amit Kamkar.
Can I take that?
Yeah, ma'am.
Can I take? Yeah. So see, current evidence says that the virus can stay inside the body for a pretty long time, but it will not be in its infective state. Okay, so what we are saying right now is somewhere between 14 to 17 days, the virus is infective inside your body. But after that also, it can survive, or the particle can be there inside dead and dying lung cells. So the test may come positive for almost 28, 30, 45 days also. But current evidence, again, I will advise everybody, please take it with, the disclaimer that this is an ongoing pandemic. So in an ongoing pandemic, there are no hard and fast 100% rules for anything. We are also learning because this is an evolving disease. But the maximum number of doctors and the evidence many hospitals are saying is that patient will be infective for 14 to 17 days. And that is what we should remember. That is why now there is another question I was seeing in the thing that should a person get retested? So to reduce the burden on the testing capacity of our, testing facilities, the current understanding is that there is no need for retesting to discharge a patient. ओके सो आपका टेस्ट पॉजिटिव आया, आप हॉस्पिटल में थे या होम आइसोलेशन में थे, 14 डेज के बाद आप नॉन इन्फेक्टिव हो ऐसा हम अज्यूम कर रहे हैं, और आप 21 डेज के बाद आपके डॉक्टर का सर्टिफिकेट लेके यू कैन रिज्यूम योर एक्टिविटीज समवेयर बिटवीन 21 to 28 डेज. आपको जॉब को भी जाना है तो 3rd वीक होने के बाद जाना है, तो तब तक तो आप नॉन इन्फेक्टिव हो गए हो. इसलिए ऐसे समझा जा रहा है कि फिर से टेस्ट करने की जरूरत नहीं है. मगर आई थिंक व्हाट दे मीन इज सम हॉस्पिटल्स आर इंसिस्टिंग ऑन अ रीटेस्ट. तो उसका क्यों इंसिस्ट कर रहे हैं? क्योंकि अगर आपको कोई प्रोसीजर करना है, सी मेनी टाइम्स क्या होता है, आप हॉस्पिटल में जाते हो किसी ऑपरेशन के लिए और बाय चांस पता चलता है कि आप कोविड पॉजिटिव हो, तो आप पूरा कोर्स करोगे, आप 21, तो ऑब्वियसली वो जो प्रोसीजर पेंडिंग है आपका करने का, वो करने के लिए डॉक्टर इंसिस्ट करते हैं कि आप फिर से अभी रीटेस्ट करके नेगेटिव रिपोर्ट लेके आइए. बट मेरे अंडरस्टैंडिंग से जो कुछ मैंने तज्ञ लोगों का, व्हाट द एक्सपर्ट्स आर सेइंग इज, फॉर डिस्चार्जिंग अ पेशेंट और फॉर समबडी टू be declared as non-infected, there is no need for retesting. Okay, so as of now, even you have heard that Kanika Kapoor's story. She came positive 7 times. Okay, her test was positive almost 7 times. So we are still learning as we go, and there are different strains of the virus. So you never really know, but majority evidence says कि 14 to 17 days के बाद आपका टेस्ट नेगेटिव आना चाहिए. अगर वो पॉजिटिव है तो उसका मतलब है कि डेड वायरल पार्टिकल भी आपके बॉडी में कोई डेड सेल्स में प्रेजेंट है जो ये टेस्ट ने पिकअप किया है. That is the what I understand as of now with the available evidence. This may change any time because this is an evolving situation. So we don't know. Every day new evidence may come up. As of now, with the current understanding, that is what we know. Yeah.
Thank you, ma'am. Yes, sir.
I have just additional point to Dr. Asawari madam, what she has said. There's a lot of people who have been discharged from the hospital, recovered and discharged from the hospital, have got a false notion that I can no longer, I don't need to wear a mask now. So please don't be under that impression. Like Dr. Asawari Madam has just mentioned, the virus might still be there in your body. It might not infect you, but it can probably, you never know, it can spread to others. So mask definitely is our sole help to slow the disease or stop the progression of the disease. So this is just in
I think
continuation.
Vikas has got similar question, Dr. Vikas Kumar Dara. If anybody tests has found positive corona patient, is there any chance of reinfection of corona in future?
Yeah, so
Yes,
there is. We don't know whether, I mean, there is no proof that development of antibodies is protective. As of now, we don't have 100% proof कि आपके बॉडी में IgM, IgG आ गया, IgG एंटीबॉडी आ गया तो आप कभी भी रीइंफेक्ट नहीं होंगे. कोई आर्टिकल्स अभी इटली, न्यूजीलैंड ऐसे जगहों से भी आ रहे हैं. Like people who are discharged may come back with reinfection. You can't say.
Because there is a mutation, and then you might have a new
New
mutated
virus.
virus in your body. So, yeah.
Yes.
Dr. Sudhir Ingre has got something to say. A normal reading is less than 10 milligrams. Yeah.
He has explained about another viewer's question about CRP. So depending on which method you use, CRP normal is less than 5, but up to 10 we are not going to consider it very significant. That's what he is trying to explain here. And many other conditions do cause a raised CRP, but in COVID patients, CRP is in hundreds, not in 5, 10. You know, in really full-blown COVID, the reading will be maybe 80, 100, something like that. But again, a disclaimer, many other diseases can give a positive CRP. So it's not a diagnostic test. It is just a test which is telling you the severity of your illness.
Post-infection, how many days the patient remain ineffective? Kiran.
So I said that currently we are considering it as 17 days. Between 14 and 21, so we are considering 17 days as the cutoff.
What is the percentage of COVID infected below age 10? Prithvi.
Suraj, you want to take that?
Okay. General statistics have been through a spectrum of age that we see, but percentage of children less than 10 years of age, there is no data in India to give a figure to that question. But however, a few things which I would like to highlight. Today, since it's COVID is designated as a pandemic, so for all reasons, all cold, cough, flu-like symptoms, even in children, are considered COVID unless proved otherwise. Since it is declared as a pandemic by WHO, this is not my statement, this is a pandemic. So it comes with its own rules. So we all consider that all these cases are considered as COVID unless proved otherwise. By and large, children have shown that they do very well in terms of recovery. There is no clear data on how effective they are. Like I was just reading on BBC today that the schools are going to open in England now because there is a study which says that children are not as infective also. As much as adults spread infection, children don't tend to spread the infection as much as adults. This is a study which I just came across in England. But again, it's an evolving process. We all have to wait for some time before we can come to some decision on this in India.
Yeah, and I also read one article which said that when the US schools opened up in August, they had a huge, they tested everybody who was coming to school, and almost 96,000 per day they were finding positive children in schools. So it's not like children are not affected by COVID. Only thing is, like Dr. Suraj says, that maybe they are not so capable of spreading the infection. We are still trying to learn about that.
Dr. Ashwini, how long we can hold children at home?
I wish I could answer that. It is.
That's my question actually.
I think children are reaching the end of their patience now, and so are parents. But children are also very adaptable. I think they've all accepted that this is how it's going to be for a while. Given a choice, of course, they would all love to go back to schools
We
and
have
colleges.
accepted PUBG, madam.
I know. That's what I said earlier. So, addiction to video games is definitely on the rise because of these, staying at home. But we just hope, I think we're just hoping another month or two and kids can go back. But in general, I've been surveying young people. They're not doing very badly. They're okay. They have adapted. They have good days. They have bad days. But I think overall they're doing pretty okay. I don't know how much longer. I think festivals. Ganpati has helped a little bit. So we have some festivities going on at home. Then we'll have Dasera, Diwali. So we're hoping these things will keep the spirit of the kids alive and happy. Let's just be hopeful.
Thank you, ma'am. Samir Pachapur, is this possible? Stable patient can suddenly go to ICU in this COVID?
Yes. A patient is otherwise admitted in the ward who is with mild symptoms might be in the high risk category, and something like there's a word called cytokine storm, which kind of increases the inflammatory response in the body, and this can lead to sudden deterioration of the condition, and they can go into the ICU. First, secondly, one more term which we hear about COVID is happy hypoxia. Happy hypoxia means hypoxia means when the oxygen saturation is below normal is called hypoxia. The blood saturation when it comes below 90 is called hypoxia. Now, otherwise, when we are not infected, or otherwise we would always have a little dizziness, a little heavy head kind of sensation, sometimes palpitations, rapid breathing when we have hypoxia. But a lot of people with COVID have oxygen saturation up to about 85, even 80, and they are totally asymptomatic. They are walking around, they are totally happy, comfortable. So this condition is called happy hypoxia. Now, suddenly when you have an added infection or some inflammatory process which flares up, the oxygen saturation can go below 70, 75 and 70, and that is when suddenly they end up in the ICU with breathlessness. Yes, it is possible.
So once we are cured, is there any evidence of immunity? I mean, this is a question that comes somewhere else.
Yeah, immunity will be judged by development of antibodies only.
Okay.
The level of immunity will be judged by doing a antibody test.
For how much time?
And this antibody develops after, one type of antibody will develop after 7 days onward, and the second type will develop after around 14 to 21 days onwards. And it will stay, it is said that the second type, which is coming later, that is IgG, may be there at good levels of that antibody for almost 3 months. So right now what we are considering is, it may be like flu, you have to take, even if a vaccine comes, the immunity against it may be only for a limited period. So in countries where influenza is a very prominent disease, they get revaccinated almost every year against flu. So we don't know whether for COVID also we may require, it will not be like a lifelong immunity, probably. That is what they're saying. Because like Dr. Suraj mentioned before, viruses are known to mutate. So if it's a different strain, then antibody which was developed against this type of virus will not work against that type of COVID virus. It will be the same virus, but with some mutations. So maybe, so all this study is still going on. Still all the knowledge is evolving. We have to wait for the answers to this, whether it will be protective immunity or not.
What signs we should look for in children as an alarm? I mean, what are the alarming conditions that in a child in this pandemic?
I think same, no? Yeah.
It's the same. What I discussed earlier with the mild, moderate, and severe category, it's the same. See, children again don't come into the high risk category unless they are type 1 diabetes or kidney problems or with some other immunosuppressive drugs. So unless they are not with any of these comorbidities, they are still considered as not a high risk category. So again, same with mild, moderate, and severe, the symptoms remain the same.
Thank you. Prithvi, again, is it safe to visit dentist in current situation?
Not safe for the dentist.
Not safe for the dentist.
But what is happening is many people are conducting their OPD either on phone or with proper precautions. But procedures may not be. Definitely, I don't think anybody will do a procedure in the pandemic situation, unless it's
Some
a
clinics
real
have opened.
emergency.
Some dental clinics have opened with the doctor wearing the PPE kits.
Yeah,
and
the
all.
PPE kits they will wear and do it.
Snehal Shirodkar has a question. Hi, ma'am. Few days before we had fever and after taking tablets got cured, but we are not able to smell anything. Got a weird smell for a few days, and now it's fine. We can smell as usual.
Could be COVID because loss of smell is a very prominent symptom of COVID. It could have been COVID. Can't say.
So is it a
Unless you
viral
get
fever or
tested.
was it COVID?
No, Suraj will answer better, but I think many viral illnesses do present with loss of smell, isn't it? Some
Yes.
other
Yeah,
viral
when we get
illnesses.
fever also, loss
Two
of taste
things.
at least it happens.
Yeah, two things. One is the viral infection itself can be a cause of loss of smell and taste. And a lot of studies have said that is one of the first symptoms.
Yeah.
That is one of the first symptoms, loss of taste and smell. However, it is again a very transient thing and it should recover as the virus and the inflammatory markers settle and everything gets back to normal. By and large, they do recover. But again, I will say 95% recover, 5% might still have residual loss of taste and loss of smell, even could be lifelong. That is one. Two, I mentioned somewhere about not to use antibiotics for sake of, we don't want some kind of secondary problems like antibiotic induced diarrhea is quite a common problem that we see, and antibiotics can also cause bad taste to the mouth. So for these are two things which I thought we should highlight. No unnecessary use of antibiotics. Don't over medicate or don't take prescriptions from your last year's diary and treat yourself for these conditions. If it's a flu, it will just go in about 5 to 10 days. Just take the necessary precaution and that should settle the problem.
We have Sanju Radhanar. Hello, doctors. If there is an unfortunate death, can the passed away person donate their eyes? Thank you. A very nice gesture, actually.
Yes, valid question, because a lot of us talk about organ donation, and corneal donation is the first thing which we have all been doing in the past. But you cannot donate organs, because there is a different protocol for death in COVID, for patients who die with COVID, and there are some different rules, regulations. There's a different procedure for conducting the last rite. So no, the body is not handed over for any other purpose.
Mr. Kiran, I can see some questions about plasma donation.
Yes, ma'am, we can answer, ma'am. Yes.
Yeah. So, a very good question. Very nice that you all are all aware about convalescent plasma therapy. KLE has recently come up with an appeal that all those who were positive and 28 days or more have passed from their positive result can come to KLE and donate plasma. Now, I want to just say 2-3 things about convalescent plasma therapy. There is a hospital in Pune called Dinanath Mangeshkar Hospital. Now, they have been doing or trying out with convalescent plasma therapy. What they have found is sometimes the donor's blood has less number of antibodies than the patient's blood. So it may not be so useful as we are trying to, may not be. Again, nothing is sure, nothing is 100%. But the data which they presented, they have said that sometimes you find that a donor comes for donation, मगर उनके blood में जो level है, उससे कहीं ज़्यादा antibody already patient के blood में है. So it has to be taken according to the clinical situation. Second thing is 28 days have to have passed between your positive RT-PCR test. And if you want to donate plasma, you have to retest with RT-PCR and be tested negative. If you are still in positive phase, you cannot donate plasma. So this is another example where retesting is important. That you will do a test first, it was positive. Now you want to donate plasma, they will ask for RT-PCR negative. So you have to be
Negative report.
RT-PCR negative and antibody test positive to donate plasma. And it's a safe procedure, just like blood donation. And even there is no much risk to the technicians or anybody, because it doesn't spread through blood. It's that's why we are using this as a. And moreover, see, plasma therapy and all was made popular for SARS, H1N1, and Ebola. So we are trying this in COVID because it's the SARS and SARS-CoV-2 are from the same family. So we'd like to use it as a supportive therapy, and especially for very serious ICU patients, it is said to be helpful also. But each case will have to be done on a merit by merit. I mean, the merits of that will have to be case by case, and then only you can decide. But I know that I also got a forward on WhatsApp that please come forward to donate blood, and the same precautions like for blood donation. So you have to be above 18 years, above 50 kilos, and your latest RT-PCR test has to be negative, and then the blood group matching will be done, and all that will be followed by the blood bank.
Divya, Dr. Divya, how long should the Ayush Kada be taken? Hello?
I think she has to unmute.
Yeah. Hello? Yeah. Hello? Dr. Divya, you're not audible. I think we have lost audio with her. We'll take back this question again later. Santosh Mamdapur, is coronal helpful?
Coronal is what? Homeopathic, I think, no? Rachana can answer.
No, it's Ayurvedic.
Ayurvedic, okay.
Okay, coronal is the tablet, I think, tablet formulation which is done by Baba Ramdev.
Ramdev Baba.
Oh,
Yeah.
okay.
It's his formulation.
Ayurvedic.
How much time will it take for body pain to reduce? I have seen patients having too much of body pain after completing the 5 days course. Mohsin Sangoli.
Can I take?
Yeah, please, sir.
Okay, body pain is quite common with any kind of viral flu. Once you have been treated well for the viral flu, other factors which are like electrolyte imbalance, one needs to be corrected, because if you have loose motion diarrhea, then you will have some kind of electrolyte imbalance, and that can also be a cause of body pain. So that needs to be corrected. Two, we should also look for other conditions. Now we are just talking about COVID here, but we should also look into conditions like chikungunya, dengue, typhoid, malaria, etc., which is also quite endemic to this area. In Belagavi, we have all these cases quite rampant. So all these conditions can cause body pain. So if you have been treated by anyone, I'm sure the doctor will have taken into account the other factors also. You need to do the other diagnostic tests for dengue, chikungunya, and all those things. So yeah.
Divya, hi, Dr. Divya.
Hello. Yeah. Am I audible now?
Yes.
Yeah. I would like to take that question.
How long should the Ayush Kada be taken?
Yeah. Ayush Kada can be taken regularly, twice daily, as long as the infection is there in the community.
Okay. Not more than twice.
Yeah, not more than twice. And if the patient feels any side effects, like as I mentioned earlier, acidity or any other thing. So he can approach any Ayurveda physician so that the composition can be altered as per his convenience.
Thank you, ma'am.
Yeah, thank you.
Swapnil Pense has a question. Which test you will recommend, RT-PCR or rapid antigen?
Both the tests have excellent results. So depends on the facility where you are going. Right now, the understanding is that all patients will be screened to reduce the load on the RT-PCR machine, because RT-PCR machine will have a limitation to how many tests can be run per day. So depending on the load, but I feel many of the testing facilities, they are now using rapid antigen as a screening test. If it comes positive, it is reported as positive. If it comes negative, but the patient has a high suspicion of being COVID positive, so some symptoms are there, or travel history is there, anything like that, or contact with a person who is COVID positive, then that will be repeated by RT-PCR. And then the gold standard test as of now means what is the standard test for diagnosis is RT-PCR.
Thank you, ma'am. Thank you. Santosh Mamdapur, is coronal helpful? Dr. Divya?
Actually, I don't know much about this. So I have heard that it is a combination which consists of regular immune boosting drugs. So maybe it might be helpful. I mean, I don't have any evidence in hand to tell surely that it will be helpful.
Okay, thank you, ma'am. Subha Agnihotri, how often should we repeat arsenic album 30? What dose, and is camphor also required? Too many suggestions online, very confusing.
Yeah.
Who would like to take this?
This is a homeopathic question. I'll answer. This
Okay.
arsenic album was suggested by Ministry of Ayush as a preventive homeopathic medicine. So arsenic album 30 potency, 4 pills daily for 3 days, and then you have to repeat after a month. These are the
Okay.
standard guidelines given by Ministry of Ayush.
Hello.
Yes.
Yeah, thank you, ma'am. Can any of the homeopathic medicines be taken for building immunity?
Like I
Dr.
said, there
Ashwin?
is no specific, general. I cannot name any specific medicine. You have to. It depends upon person to person. We have to take the case, because person is different. Everybody's symptoms are different. The person is different. So single medicine cannot help everybody.
Thank you, ma'am. Teju Chogle Chandgadkar. Is she still saying something? Hello? Teju Chogle Chandgadkar. Hello, doctors. I have a query. There are rounds going on saying that we need to take vitamin C, vitamin D3, and zinc tablets for boosting our immunity. Is this helpful? And if yes, how many days should one take it?
Clinician. Suraj will have to answer. He's the clinician there.
Okay, vitamin C and vitamin D3. Yes, definitely. Vitamin C, vitamin D3, zinc. They are definitely known to help us and are good immune boosters. Probably there is a study, and these are given as therapeutic also. They are not just kind of as immunity. Even I have seen them, and we do prescribe these drugs for mild to moderate cases. This is helpful, and if yes, how many days should one take it? As prescribed by a doctor, but they can be taken for. I mean, see, if you're taking in the prescribed doses, you have combination as well. Now, vitamin D3 is available both in as a single therapeutic drug, and you get it in combination. Zinc is also like the same way. So you get these therapeutic combinations which are standard for adult weight. They can be taken for up to a month also. There's no harm in taking them. But they're definitely therapeutic, as well as, in the preventive side also. Probably they help in reducing the symptoms.
Thank you. Thank you. Mushin Sangoli, had we taken this question earlier? No. Also, patient is too weak after consuming good amount of food and foods. Weakness is, doctor, since long time now. How much time will it take for a person to be normal and healthy?
See, here we have to look at the comorbidities. Are there any other medical problems? As I earlier told, electrolyte imbalance if there needs to be corrected, and long time means how time. See, generally by and large, I have seen in not COVID, any flu-like conditions, up to about 10 days to 2 weeks is an average time that it takes for your body to set back the clock and get to normalcy. But if it is more than that, say if it is more than about 2 to 3 weeks, if it is disproportionate to the symptoms of COVID, then I think he or she might need some investigations and workup, because there are other causes which can lead to a weakness.
Okay, thank you, doctor. Any symptomatic relief medication for COVID and homeopathic, like paracetamol in allopathy, Dr. Rachana?
I'm telling you, there is no fixed medicine in homeopathy for any disease. It depends upon person only. Yeah. After knowing his symptoms, then we decide what is the exact remedy. The homeopathic doctor will tell when the patient goes to him.
Tejasri Pradhan, thank you all panelists for sharing valuable information. My question is, many people might be asymptomatic. How can we stop them from infecting others in the community? SMS.
Yes, that's the only thing, SMS. And again, I would, from personal experience, I will tell you, there is, people are hiding that they had COVID. Okay, so even if they are asymptomatic and they have the report also, they may not come out and tell you that they were positive. So let us treat that everybody is positive and take the proper precaution. Just social distancing, mask, sanitization, hand washing. That should be good enough. And with this 10 days of Ganpati, I'm really very worried now, because you saw the kind of crowd in Friday evening, Saturday, Sunday. A lot of crowding is taking place. People should not take it so lightly, I feel.
Yeah, yesterday I was so happy. It was the highest number of discharge actually from the time this whole pandemic started, 511.
Yeah.
And almost half of that was positive. I don't know what should happen, but let's leave it to
I'm just
Ganesh.
going to add on 2 points in this to Dr. Asawari's SMS. One is the use of mask. A little clarity I would like to highlight. That's why I'm going to take 2 minutes on this. Friends, we have masks which are available in different types, sizes. You have fancy masks, you have designer masks these days, but I'll just give you a brief. Now, this is N95 mask. It'll be written here. It's an N95 mask. Then you have masks like these, which are cloth masks, basic simple cloth masks. And you have the surgical masks, which are those blue ones. They're 3-layered, 2-layered masks. And we see our Honorable Prime Minister, who typically comes with something like this. And he comes to most of the meetings and addresses people on national television or public forums. So, friends, whatever you use, please use the mask properly. First of all, the mask has a proper way that you to use it. Now, you have to wear a mask which covers your nose and which covers your mouth and all nice seal. I use the word seal. It should be nicely sealed all around your face. So this, definitely see this. There's a nice seal here. So wear the mask. Yeah. This is the right way of wearing the mask. I'm sure most of us have seen people when they have to talk. Now I'm talking to you on this live show, but I'll just give an example. I don't do like this and I don't recommend. Most people do something like this. They go to a grocery store and then in front of the grocer, they put a mask, and the moment it's done, they put it down. Now here I would like to highlight 2 things. One, this is the exposed portion. Friends, this is the exposed portion of your mask. So when you wear a mask like this, this is which comes in contact with all the world, all the people who are around you. And the moment this masks come down like this, see what happens? This exposed portion comes to your neck, like this. Okay, and this portion, which is supposed to be facing you, ultimately ends up going into your mouth. See what happens. Okay,
It's
so
just like taking a cup of tea.
all of you have seen people do this, and it is so distressing to see people remove the mask and wear it again, and they're infecting themselves more. So it's doing more harm than good to you. So please do not wear the mask like this. The mask has to be properly worn, snugly fit around your nose and your mouth. This is one. Whichever mask you use, it doesn't matter. 2-layer, 3-layer, a cloth mask is equally good. I don't recommend that everyone should have a N95 mask. In fact, I recommend people don't use an N95 mask. The reason is simple. See, this is for healthcare workers who are into, who meet people, who meet a large volume of people, and to reduce the viral load, we use these masks. But for a common man going to the stationery or a grocer or going to the market or just walking around in your colony or something, you don't need that. Even a good cloth mask can serve. 90% of droplet aerosol generation is reduced even in a normal cloth mask. So and this is more eco-friendly. This is bad for the environment. I don't recommend this. This is more eco-friendly. So please use this mask, can be washed every day. Secondly, as we all have a seatbelt in a car, and it is recommended that you wear a seatbelt the moment you sit in the car for all the passengers. This is the seatbelt to prevent COVID. Friends, I repeat, this is the seatbelt to prevent COVID. Our responsibility, A, is to slow the transmission of COVID. The moment I wear a mask, I'm going to slow my transmission of COVID to my people around me. So first, slow the transmission. 2, if possible, stop the transmission. That is where washing hands, sanitization, don't go out where not required. So first is slow the transmission and stop the transmission. And then comes the question of patient care. And see, we have a responsibility to the society as well. The entire society, the entire country, the entire world, everything around us is revolving around COVID today. All the discussions are happening around COVID. Our students, our children are losing on their valuable growth phase. So why? If you can use this responsibly, I'm sure we will be kind of will be helping the society to grow much better. We'll allow our children to go back to school. I'm sure business models, everything will get back to normal. So I request people, humbly request people, use the mask, use it properly. Thank you very much.
Thank you, doctor. No, we don't have that. Is mask advisable during morning walk or jog?
Okay. I would recommend, if you have to go for a morning walk or a jog, firstly go alone. Don't go in a community. I've seen people who go with 4 friends because they used to go for a walk before COVID. And I strongly don't recommend going for a walk in a group. So you have to go for a walk. Yeah, you need to be fit. Like Dr. Divya said, exercise is important to take care of as a preventive part. So you need to exercise, be fit, stay healthy. You can go for a walk, but please, you have to go all by yourself. Don't go in a group. Don't go with friends. 1. And 2, prefer exercising at home if most of the times. And when you are exercising, please don't wear a mask. When you are exercising, please don't wear a mask. Because this mask, N95 masks, filters about 50% of what you breathe. So you're actually inhaling 50% less. Your body gets used to it, and as it is, the environmental oxygen is just about 20%. So that's okay for us to live, but it's not good to exercise because your body is in more demand of oxygen that time. So don't use mask while exercising.
Thank you, doctor. Question to Ashwini Belgaumkar. Advise how to get out of fear of COVID amongst general public.
Yes, I agree. There's a lot of panic happening, amongst people as the cases are increasing. We are now reached a stage where people whom we know are affected by COVID. So I think it's coming much closer to us, and there is definitely some fear. I see fear, I think a lot of information. So how to handle fear is to have information. So the first step to handle fear is to, please stay away from Dr. WhatsApp, right? A lot of information out there, a lot of it which is not valid. So I think it's very important to follow, sites like, like hospital sites, so the WHO, the Ayush, things like that, which we follow. So information. So the first thing against fear is to have correct information. I think a lot of correct information has been given today. So ask yourself is correct, and try to avoid social media. Try to avoid reading everything that comes on WhatsApp about COVID. There's just too many people out there setting out alarms. So just stay away from. I'm reading very little about it, except very valid sites as first. And the second thing is that, of course, keeping a positive attitude is very, very important. It could happen, it may not happen. We just keep our fingers crossed, as the doctors are saying, SMS. We take all the precautions possible to take care of ourselves and hope that it doesn't happen. Follow a regular routine, stay positive, connect with friends on Zoom, do productive things. So your mental state, we try to keep it positive, reduce the stresses in our life, be positive, and hope it doesn't happen. And we have to be prepared for the worst eventuality. Okay, so suppose it happens, everyone is saying 80% of people who get COVID will have mild flu-like symptoms. So we hope and pray we will be amongst the 80% who don't we're in the mild or moderate category. And the worst case scenario is that, we need to be hospitalized. So we believe that, we do have good doctors, will be well taken care of, and we'll definitely fight it. So, we hope for the best and prepare for the worst. And I think we're also hearing that, the end is near. We've peaked now, another 2 weeks and things are going to get better. So, I think just keep hope alive, stay positive, read good things, focus on discharges more and less on positive cases. So we have to kind of, there's so much information out there. I think it's very, that's what leads to panic. So I think filter what you read, filter what you process. I think that's very important, and just let's stay positive. And we're all in this together. There's a very nice term that's been coined, which is apart together, right? So we're all together in this, but we're just away, physically away. So I think just staying positive and preparing for the worst, is taking all precautions, is what's going to help us stay positive.
Thank you, Rata. Thank you so much. We have a question from Joyce Gonsalves. What does it mean when your PCR test is negative and a week later an antibodies test is done and your G and M both factors are positive?
Yeah, so this probably means that the RT-PCR was false negative. That's what I understand from this. Because if they have developed antibodies against it, it means that they were infected. And if IgG and IgM both are positive, they are still in the early phase of the disease. It's not a very old infection. It's probably somewhere between, say, 14 to 28 days since you got infected, if IgM is also still positive. Now, I just want to take this opportunity to clarify that once more, that a negative PCR doesn't mean that you did not get an infection. Okay, so there is a 30% chance of people being missed even by the RT-PCR test. But if you've developed antibodies against it.
Just 1 minute. I know this case. She's my friend's mom, she's my friend's sister, who's taking care of her mom now. She has got a femur bone fracture. Okay.
Oh.
And her operation is due since, I think, almost 15-20 days. She was positive, then later she had come negative. But now to get operated again, they need a test. What can she do in such condition?
About the operation or about
yes,
her?
About the operation.
Yeah.
Because doctors are insisting on the test.
Yeah, so she cannot move, I think, from the house.
Yeah,
that's
she
the
cannot
question.
move. So every time the test is to be done, she has to be taken in an ambulance to the hospital and got back from there.
Right. But from personal experience, I know that BIMS people, they do come to the house of positive people and they do the rapid antigen test there itself. So maybe we can request a
No, but
team
rapid
who's
antigen test is not considered as one when they're in the hospital for the operation.
is it they are
We had
insisting
looked
on
in for that option.
RT-PCR, is it?
Yes,
Hmm.
yes.
So then a technician will have to be requested to come with the full PPE, collect the sample and do the RT-PCR test. I'm not aware whether KLE provides that facility, but in a
Okay.
special condition, I think we should talk to the authorities and get this facility done for her. As long as the technician knows to wear the PPE and take the sample, it can be taken at home also. But as a special case, they will have to request somebody to come and take the sample from her.
Thank you so much, ma'am. Uh, it was nice having you all here on All About Belgaum, and everything was explained in detail. We are very lucky to have you on our program here today, and we hope all the viewers' questions were answered. Just one more question I would like to take. She was showing G symptoms from the 16th July.
Yeah, so technically, see, if she was showing symptoms on 16th of July, so by 31st July, she is anyway non-infective, is what our current understanding would be. Now, again, I will quote Dinanath Mangeshkar Hospital. If you see their videos on YouTube, they don't even insist on a test for COVID, actually. So they perform, as long as the procedure is safe. I don't know what procedure she requires. I'm not a clinician. But if it's not I think she would require general anesthesia, which is going to be the problematic thing to, because it will be an aerosol generating procedure. So that is why they are insisting on the test to be negative before they can take her up for the operation. So I hope that, and I know that the orthopedician who is treating her would have taken the proper whatever other, supportive treatment that needs to be done. So let's see how we can work out for this particular case, and maybe I'll talk to somebody and we can get some help for her to
That would
get
be
the
highly,
RT-PCR.
highly appreciated, ma'am.
Yeah,
Thanks a
we
lot,
can do
ma'am.
that.
Thanks.
Yeah.
I'm very thankful to Dr. Asawari, Dr. Suraj, Dr. Divya, Dr. Ashwini, Dr. Rachana, and especially Dr. Varsha from Health Pals for getting you all here.
Yes.
It was very kind enough of her to get us all here. And I would request all our viewers, if you have any questions or anything, you can please visit Health Pals and you can put in your query and it will be answered by one of the professionals who are there. Uh, Thank you so much for having you all.
Thank you.
Thank
Thank
you.
you.
Thank you.
Thank you
Thank
for
you so
giving
much.
this
And all
opportunity.
great job you are doing at All About Belgaum. Keep it up.
Yes,
Thank you, ma'am. Thank you, ma'am.
absolutely. Thank you,
Excellent.
Kiran. Yes, take care.
Thank you.
Thank you so much.
Thank
Thank you.
you so much.
Thank you.
Bye.
Thank you.